like a rough draft. Hello everyone, welcome back to KinetiCare by Dr. Abir Ali. In today's lecture, we are going to study one of the most important and clinically relevant topics in upper limb anatomy, muscles of the shoulder region. By the end of this lecture, you will be able to understand intrinsic and extrinsic shoulder muscles, learn their origin, insertion, nerve supply, and actions, and most importantly, apply this knowledge in clinical scenarios. So let's get started. 1. Introduction. The shoulder region contains a group of muscles that stabilize the scapula, move the arm at the glenohumeral joint, maintain mobility and strength. Extrinsic, Axioscapular and Axiohumeral muscles. 2. Scapulohumeral muscles, intrinsic muscles. These muscles originate from the scapula, insert into the humerus, provide a deltoid. The deltoid is medial rotation. Middle fibers right pointing arrow abduction, 15 degrees to 90 degrees. Posterior fibers right pointing arrow extension and lateral rotation. Clinical tip. If the axillary nerve is injured, right pointing arrow loss of shoulder contour occurs. B. Supraspinatus. Origin. Supraspinous fossa. Insertion. Superior facet of greater tubercle. Nerve. Suprascapular nerve. Action. Initiates first 15 degrees of abduction. Stabilizes shoulder joint. Clinical note. Most commonly injured tendon in rotator cuff. C. Infraspinatus. Origin. Infraspinous fossa. Insertion. Middle facet of greater tubercle. Nerve. Suprascapular nerve. Action. D. Teres Minor. Origin. Upper 2/3 of lateral border of scapula. Insertion. Inferior facet of greater tubercle. Nerve. Axillary nerve. E. Teres Major. Origin. Inferior angle and lower lateral border of scapula. Insertion. Medial lip of intertubercular groove. Nerve. Lower Fsubscapularis. Origin. Subscapular fossa. Insertion. Lesser tubercle of humerus. Nerve. Up. Stabilizes shoulder joint. 3. Extrinsic muscles, Axioscapular and Axiohumeral. These muscles connect the upper limb with the axial skeleton. A. Trapezius. Actions. Upper fibers right pointing arrow elevation. Middle fibers right pointing arrow retraction. Lower fibers right pointing arrow depression of. B. Latissimus dorsi. Action. Extension. Adduction. Medial rotation. Nerve. Thoracodorsal nerve. C. Levator scapulae. Action. Elevates scapula. D. Rhomboids, major and minor. Action. Retract scapula. Downward rotation. E. Pectoralis. F. Pectoralis minor. Action. Stabilizes scapula. G. Serratus anterior, also called the boxer's muscle. Action. Protraction of scapula. Rotator cuff, sits muscles, a very important concept for exams in clinics. The rotator cuff muscles are sits, Supraspinatus, Infraspinatus, Teres Minor, Subscapularis. Function. Stabilize the glenohumeral joint. Keep humeral head in place. Allow rotation and abduction. Common injury. Supraspinatus tendon tear. 5. Clinical anatomy. Let's quickly revise important clinical correlations. Rotator cuff tear. Painful arc syndrome. Weak abduction. Axillary nerve injury. Loss of deltoid function. Inability to abduct arm. Winged scapula. Due to long thoracic nerve injury. Serratus anterior paralysis. Shoulder dislocation. Most common right pointing arrow anterior. May damage axillary nerve. So that's all for today's lecture on muscles of the shoulder region. If you found this lecture helpful, like the video. Comment your questions. Subscribe to KinetiCare for more anatomy lectures. And don't forget to share this with your classmates. See you in the next lecture. Stay consistent, keep learning.